Hello everyone, it's Dr. Martin with the medical message for today. So as many of you already know, I had a sleep study done on yesterday. And I had posted that I didn't feel like I had really slept. Well, I was there they monitored me from 9:30 p.m. to about 4:30 the next morning. I got 150 minutes of sleep. That's a little over 2 hours. So I didn't really sleep. Also, they needed 120 minutes to do an effective evaluation. So I just made it at 150 minutes. Additionally, they determined that my oxygen saturation was pretty normal when I was awake, about 95%. It dropped to 87% when I slept, which was a little too low. I did not have any cardiac arrhythmias or abnormality in my rhythm. As a result of that, they did not determine I had any restless leg syndrome. So long story short, I had, I think, 18 episodes of when my saturation dropped. So according to my study, I have very mild, actually I don't have apnea, I had hypopnea. What does that mean? What's the difference? So apnea is when you totally stop breathing for whatever length of time. Hypopnea means my saturation dropped too low. So I didn't have complete apnea, but it was close. So now what? So we talked about it, myself and the specialist, and we're gonna do a conservative treatment for me since it was only mild. So I'm going to attempt to lose about 10 more pounds and retest in about 6 months because I really feel like it was probably worse when I was a little heavier, right? So let's talk about sleep apnea for a little bit. So it's a sleep disorder where the airway collapses during sleep and it leads to pauses in your breathing throughout the night. And in some patients, this happens like multiple times during the night. And they're very tired the next day and they don't know why. They don't realize they stopped breathing and have awakened several times during the night. So what are some of the symptoms? So someone tells you have loud, frequent snoring, which my kids and grandkids said I was snoring a lot. Not so much now, but I was. If you feel like you're gasping or choking during sleep, waking up feeling tired throughout the day, those can be symptoms of obstructive sleep apnea. Okay, so what's happening is your airway is collapsing during the night. And the more weight on your neck area, so if you're obese, it's collapsing on your airway and causing your oxygen to decrease, the saturation to decrease during the night. So we talked about the snoring, pauses in breathing, waking up feeling like you stopped breathing. I had that happen to me one time. This is no joke, y'all. And so during the day, you'll feel fatigue. You may have chronic fatigue, headaches in the morning. If any of you all have any symptoms, take note. Irritability, can't concentrate, falling asleep at work. Y'all know y'all fall asleep at work. Falling asleep watching TV, falling asleep even driving. That's why it's going to be very dangerous. Get behind the wheel, you don't even know you're tired till you're out. Okay? So what are some of the risk factors? A really common one is being obese. If you have a family history, if you're male, if you have a narrow airway, if you have a short jaw, all those things can contribute to you developing sleep apnea. Also your age. The incidence increases the older you get. Y'all don't need to know how old I am. I'll tell you because I'm not ashamed of my age. I'm 66. I'll be 67 in a few days, okay? So the older you get, the more prone you are to developing sleep apnea. Things like alcohol consumption before you go to bed, smoking, all those things can lead to apnea episodes during and throughout the night. So treatment's going to include CPAP. That's a mask you wear at night that gives you continuous positive airway pressure. It helps open up that airway during the night so you don't desaturate, meaning your oxygen does not decrease during the night. Keeps your airway open. They have those that can go over the whole facial area, or some that just are nasal. Depending on the severity of your condition will determine which one you can be fitted with. Okay. So with me, like I said, I'm going to do conservative for right now. Lose 10 more pounds. I'm going to retest. Should avoid alcohol, okay, in the evening, especially before you go to sleep. And some patients may even require surgery to fix things in their airway that can be, for instance, you've got big adenoids or tonsils, maybe causing some narrowing of your airway. Okay. So the test I had is called a polysomnography. They put electrodes to check my brain function. I had things in my nose to detect my saturation on my airway, whether it was collapsing or not. They could determine that. I had a pulse oximeter on that did my O2 saturation, EKG monitoring, the works. I could barely move, right? So listen, guys. Also, keep in mind, when you have obstructive sleep apnea, it can lead to heart problems. Think about it. Your oxygen's getting too low. Your heart requires oxygen. So it can worsen high blood pressure. It can worsen congestive heart failure. And it can cause you to die. So listen, if you're overweight, obese, snoring at night, this is no joke. Go get tested. I did. It's mild. I'm going to get rid of it because what? I was proactive. Okay? Got tested. And now I know what I'm working with. All right? So the doc's going to be okay. Y'all got a little bit of information on sleep apnea. Many of y'all out there have it. Don't know it. In denial. Don't want to know it. Don't want to lose weight. Don't want to stop the drinking. Keep playing. Trying to keep you around here. That's my message for today. Trying to give you long life. Okay? That's the goal. Long, purposeful, healthy life. Right? So, the Bible says it's his desire that you prosper. Be in good health. Even as your soul prosper. But you got to do the work, y'all. All right? So this is Dr. Martin. Y'all got all up in my business tonight. You know how old I am. You know I lost 30 pounds. You know I need to lose 10 more. That's enough of my info out there. All right? So I did this so I can help somebody. And if that somebody is you, drop it in the chat. Let me know. All right? So I'll see you next time. This is Dr. Martin, and she's out.